he and I are partners. They're gonna tell us to go to room 2, wherever the room is, you're on station 1. So we go up, he and I go up, knock on the door, go in, the examiner's gonna say, welcome to the adult resuscitation station. You and your partner will be handling the scene. Who wants to go first?
We'll go first.
All right, so he's gonna say that I'm responsible to detect the call. He's responsible for just his compressions. Do the whole station, and we break it down completely and switch, okay? So the first thing he's gonna do is say, check your equipment, make sure you have everything you need and it's sufficient for your purpose. So I left everything bagged up so we can see and go through as we go. If during this station, when you're checking your equipment or at any point, you see some piece of equipment you're not familiar with, ask. The examiner will explain it and if necessary, demonstrate it. You can't make you use a piece of equipment you're not familiar with. So I have my mannequin, I have my partner, I have my AED, as well as my pads, and I'm familiar with it. I have my BVM, my mask, my tank, my O2 line, I've got my regulator, my reservoir, my wrench, and my OPA. So, Mr. Examiner, I have everything. He's gonna say, okay, you're being dispatched to see an unresponsive patient. You and your partner will be arriving on scene. Your job is to tech the call, which means you're responsible for everything in the call to include his compressions. Once you're done, you'll stop, break everything down completely, and then you'll switch. And then he'll be responsible for everything and me just my compressions. They'll give you a couple of little caveats, thing to watch. First of all, once you start compressions, do not stop them for more than 10 seconds at any given time. And ensure that you get proper chest rise with each and every ventilation. And when you put the pads on, put them on exactly as they show on the diagram, okay? He's gonna say, do you have any questions? No, I don't. He's gonna say, okay, you're in the back of the ambulance, set up your equipment. Scene safety BSI for myself and my partner. I'm gonna set up my equipment. I'm gonna take my O2 tank. I'm gonna use the pin indexing system, good catch. I'm gonna make sure I have the O2 ring. And I'm gonna put the regulator on the tank, ensuring that it's properly lined up. Tighten it down. I am going to take my regulator, my wrench. I'm gonna open the tank all the way and come back half a turn. And I'm gonna look at the tank. Mr. Examiner, I'm showing 0 for tank pressure. A full tank is 2,000, change it out at 500. The exam will, the actual national exam will have tanks with O2 in them, so you'll actually get a reading. None of our tanks do. I'm gonna take my O2 line, connect it to my regulator. I'm gonna take my BVM, put my mask on my BVM, put my reservoir on my BVM, take out my OPA there. Then I'm going to turn on my liter flow to 15 liters, high flow O2. It's running, blow out the air in this, if there's any particulate in there. I'm gonna put that on, and I'm gonna lie this down. Now, Mr. Examiner, I'm gonna ensure that my reservoir is filling. I'm gonna make sure I can get a good seal when I squeeze. Every time I squeeze and release, the bag deflates and reinflates. And then he's gonna say, okay, is your equipment sufficient for your purpose? Yes, it is. He's gonna say, okay, you can arrive on scene. Again, scene safety BSI for myself and my partner. I'm gonna approach the patient, the patient. Sir, can you hear me? Unresponsive to verbal stimulus. I'm gonna elicit a painful response by pinching the air. Unresponsive to painful stimulus. I'm gonna do the head tilt, chin lift, just like this. Tilt the head back, look, listen, and feel. Look for chest rise, feel for breath in my face, and feel for air in my ear. While I'm doing that, I'm gonna slide my finger down, same side, and check for a pulse. Mr. Examiner, I'm gonna check for 5 to 10 seconds. Any pulse or breathing? No. Begin compressions. Count out loud.
4, 5,
At a depth
6,
of 2 to 2.4 inches,
9,
at a rate of 100 to 120 per
13,
minute.
14.
Do not plug in your pads
18,
until
19,
after you
20,
get them in place.
22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2,
See that I'm on my patient's left side, it's easier for me to put my pads on?
9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2.
Apply
3, 4,
do not
5,
touch the
6,
patient.
I'm clear, you're clear, everybody's clear? See how he's
Do
hovering?
not touch the patient. Analyzing heart rhythm. Shock advised.
Compressions,
Charging.
2,
little
3,
deeper.
4, 5,
Stay clear
6,
of
7,
patient.
8,
Deliver
9,
shock
10.
I'm
now.
clear, you're clear,
Press the
everybody's
orange
clear?
button. Shock.
You're getting
delivered.
compressions.
Two.
It
I'm gonna
is
take
safe
the
to
OPA.
touch the
I'm
patient.
gonna measure from the corner of the mouth to the corner of the ear.
Begin
I'm gonna do the
CPR.
scissor finger technique. Insert an upside down till it hits the soft palate and rotate. Does he accept it?
1,
Yes.
2, 3, 4, 5, 6, 7, 8, 9, 30.
Make sure you get chest rise. 1 breath, 2 breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2,
Yeah, he's
3,
counting out loud.
4, 5, 6, 7, 8, 9, 30.
1 breath, 2 breaths.
1, 2, 3, 4, 5, 6,
And
7,
that beep
8,
is the,
9,
that you can
10.
use that for
2,
compression rate.
3, 4, 5, 6.
You can go faster,
7,
but don't go
8,
slower.
9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30.
1 breath, 2 breaths.
1, 2, 4, 5, 6, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30.
1 breath, 2 breaths.
1, 2, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30.
1 breath, 2 breaths.
1, 2, 3,
Nice, easy,
5,
nice and
6,
easy breaths.
7, 9, 10. 1, 2, 3, 4, 5.
Do not touch the
Stop.
patient. Analyzing heart rhythm.
So the examiner may or may not turn off the machine, but now he's gonna say, okay, what happens now? Mr. Examiner, we're gonna reanalyze. If it says to shock, we're gonna shock, continue with compressions, and keep doing that until ALS arrives. If it says no shock advised, we're gonna continue with compressions, reanalyze, and continue to do that until ALS arrives. He's gonna say, okay, what is the depth of compressions?
2 to 2.4 inches.
2.4. What is the rate we're trying to get attained?
100 to 120.
100 to 120. What is the ratio?
30 to 0.
30 to 2.
2. When to remove the pads?
Never.
Patient has a hairy chest.
Shave it.
Patient has an internal pacemaker defibrillator on the same side.
Remove
Patient has a medication patch.
it and wipe it.
Patient's in a puddle of water.
Remove them and dry.
And when do you remove the pads?
Never.
And can you analyze a moving patient?
No.
All right. Then they'll say break it down. Break everything down and completely close the tank and you switch. Remember that if the examiner tells you to close the tank during the exam, close it by the top, not the leader flow. Because he'll say to you, for the purposes of this exam, that tank is still on, but to save the O2, please turn the tank off. You turn it off by the top and you leave the leader flow on. I didn't turn it off, so if he doesn't tell you to turn it off, you just leave it. If it runs out, not your fault. Okay? Any questions on that? All right, well, let's hit it.